Hello guys, so today I want to talk about the drug treatment of chronic asthma. My name is Chun-Gyang. I'm a medical doctor in the field of respiratory medicine. So before I go into the treatment proper, I'd like to give a background of what asthma is. So there's a lot that's still unknown about asthma. What is, however, known is that there is chronic airway inflammation that is ongoing, that usually leads to hyperresponsiveness, airflow limitation, and a presentation of symptoms that are variable in time and intensity. The symptom or symptoms generally include chest tightness, difficulty in breathing, wheezing, and cough. The goals of treatment in asthma are to control symptoms and to reduce risk of adverse events such as attacks and death. Now, the main medications used in treatment of asthma are categorized into controllers, relievers, and maybe add-on therapy or medications. Now, controllers are medications that control the inflammation that we talked about earlier on, which means that they are anti-inflammatory. Okay, they also would improve lung function over time, and then would reduce this risk of adverse events. Now, an example of these controllers is the inhaled corticosteroid, ICS for short. It is important to state that whenever the treatment of asthma is initiated, an inhaled corticosteroid, which is a controller in this case, must be started from the beginning of treatment. Now, an example of this ICS containing medication or inhaled corticosteroid, remember, is the ICS formoterol. You can also have ICS combined with a long-acting beta-2 agonist in the form of ICS LABA, L-A-B-A. Now, the second group of medication is the relievers. They are called relievers because they have rapid onset of action and they open up the airway. An example of relievers is the short-acting beta-2 agonist, SABA, S-A-B-A. It is also important to state here that the treatment of chronic asthma should never be with a short-acting beta-2 agonist alone. So therefore, there must be, or there should be, some anti-inflammatory or controller medication in the background in the form of an inhaled corticosteroid, ICS. Now, before commencing treatment, we must make sure that the diagnosis of asthma is confirmed. We must make sure that the patient is placed on a symptom level and a risk level for adverse events. Adverse events is exacerbation or attacks and death. Those are things we do not want in asthma. We must also ensure that there's a self-management plan that is in place. A self-management plan would include a written action plan, an inhaler technique that is taught to the patient. There's also a self-monitoring of symptoms that is taught to the patient. An education on the triggers that should be avoided should also be given out to the patient. I will dwell more on placing the patient on a symptom level and a risk level for adverse events. Other aspects will be dealt with in subsequent online materials and videos. Now, to place the patient on a symptom level, a step ladder model is generally being used. This places the patient between steps 1 to 5, depending on symptom or breakthrough symptoms that occur during the day and the lung function of the patient. So, remember we said from steps 1 to 5. Now, a patient who has symptoms or daytime symptoms that occur less than twice in a month or less than 4 to 5 times in a week with no nighttime symptoms is generally categorized as mild, asthma, where the patient is placed in steps either 1 or 2. If a patient has daytime symptoms that occur or breakthrough daytime symptoms that occur, between 4 to 5 times or more than 4 to 5 times in a week, and there is 1 or more nighttime symptoms, this patient can be categorized in step 3. When you have 1 or more nighttime symptoms and daily symptoms, and then there is also poor lung function in the patient, this patient can be placed in step 4. Step 5 is where you have maximum therapy in a patient, yet there is still poor control. This is basically the step ladder placement according to symptom level and lung function. Thanks for watching, and please don't forget to subscribe. For more videos, you can like and share and leave a comment.